I'm Jenny Tompkinson. I'm a respiratory specialist physiotherapist and I run the Pulmonary Rehabilitation. The programme is a 6-week programme for people who have chronic lung disease and who suffer with breathlessness as a result of that. They come along twice a week for about 2 hours and they do exercise or activity which we very much try and cater to their abilities. So although it's done in a gym setting, actually it's done to their level. The other part of the programme is a discussion group, so we look at lots of different topics to help the person manage their breathing to the best of their abilities. So we make sure they're happy with all the medications that they're on, we teach them what to do if they get an infection, for example, we teach them why it's good to exercise and how to have a healthy diet, those kind of things. Patients are referred into our programme mostly by their GPs or practice nurses. Occasionally consultants will refer as well, and we will actually take self-referral patients.
I'm Mike Rossdale, I'm a GP, but I also have a special interest in respiratory things. I'm part of this pulmonary rehabilitation programme. The key thing about the programme is to get people from around these communities where there's high prevalence of COPD. And one of the best ways of helping people is to get them into a pulmonary rehabilitation programme. We had a new drug that had as much benefit as this. Everybody going, wow, that's a wonder drug. But this is something where people can really improve. You know, if you just take a 6-minute walking test, at the beginning you can walk 150 metres in 6 minutes, at the end it's 250 metres or longer. Now a drug that could do that would be thought of as a wonder drug. Pulmonary rehab can do that.
When I first came into the class I did feel a bit apprehensive, but that soon passed anyway, because they're such a friendly lot of people. Because I'm 87, I thought it would be too old for me, but then I found my mistake, I found it wasn't, and I really enjoyed it. I live on my own anyway, and so coming down here I get to talk to other people, and some of them are in similar circumstances to me. I think going to the gym for exercising is good for people. I didn't believe it at first. I wouldn't have believed it. But I thought, well, as I said, I thought I'm too old for that anyway. But I realise now that I'm not. Since I've been doing the programme, I'm fitter for it. I can walk better and farther. I'd never dreamed I could get on the treadmill. I thought about 2 minutes and that'll be it. Now I've got a record now, 24 minutes.
Before I started this programme, I found it very hard to breathe. Walking any distance was quite an effort. But since I've been doing the programme, I've improved. I've got a lot better.
I've been with the class for 6 weeks. I was a bit apprehensive to do the programme. Didn't know what to expect. Didn't know how it was going to help. I was quite surprised. Very informative, the programme. You have a talk for an hour, then gym. And in that talk I was informed how to use my sprays. When you go to the doctor and you've got COPD or asthma, they give you a spray, but nobody actually tells you how to use it properly. So coming here was really good. The things I can do that I couldn't do before, so I can walk upstairs, do more activity things without getting out of breath. But also coming here, I'm going to start Tai Chi.
Taught exercising in my age. I'm a bit beyond that really, so I was very apprehensive. Anyway, I did agree to go along, and I thought, well, I'll give it a go and see what's involved. But at the end of the 6 weeks, and I'd been there 12 times, the benefit that I received from it was unbelievable. My walking improved, my breathing improved, my appetite improved, my performance had gone up over 300%. And then you have a talk for an hour after each session. Those talks are extremely beneficial. I'm finding it easier to do simple things like mowing the lawn, sowing the old runner beans.
Always come
and give it a go. We have quite a few patients, their initial reaction is, oh, I can't do that, I can't go on a treadmill, but come and give it a go. It's usually a lot of fun as well. You have a little bit of a laugh too, and hopefully by the end of 6 weeks you'll be that little bit fitter, you'll know an awful lot more about your condition, be able to manage it better, and you've met other people as well who are in the same boat as you were in.